North Arkansas Partnership for Health Education is all about how two great organizations like North Arkansas College and the North Arkansas Regional Medical Center can work together to do more than either one of them could have done on its own. We started this partnership about 15 years ago, and really we had two goals in mind. We wanted to encourage area young people, area students to consider medical careers. And second, we wanted to provide continuing education for the people that were already in medical fields. And this benefited both the college and the hospital. The college has almost a third of its graduates going into allied health careers. And of course, our hospital has a need for all these professionals. So the obvious benefit was to encourage young people to go into these programs, to be nurses, to be CNAs, to be med lab techs and rad techs and surge techs and paramedics and the other majors that we offer. But also the benefit to having continuing education here at home for allied health professionals also was a great one for our college classes, because our students who were in these programs were exposed to all these experts that come in and present in their fields. So that's the way we got started, for those two reasons. But with the tobacco settlement money, we were able to expand the program. We were able to offer more initiatives. We were able to go into other areas. We started Arkansas's first hometown health improvement project. We've started support groups for chronic diseases. We've done so many other things that have all been entrepreneurial in nature. We have a community health resource center where if a patient goes to see his or her doctor and they're diagnosed with some kind of disease, they can go to our community health resource center and read about the disease and follow up on the doctor's advice. And the doctors have started referring these people to the center. We have a Susan Komen program where we fight breast cancer and encourage regular checkups, and we have all the pink out nights and the other things that are associated with that. We've got so many good programs, and we've taken this NAPHE partnership that started with really two people and expanded it into a staff of a couple of dozen. And we've really done it in an entrepreneurial type way. We haven't spent a lot of the college's money. We haven't spent a lot of the hospital's money. We've been able to get the grants and take advantage of the opportunities and grow the program. And really, one person deserves a lot of credit for that, and that's Dr. Rick Henneter. Rick was the first executive director of NAPHE. He had the vision for what it could become, and for years he did a wonderful job running the program. Now we have Sherry Hendricks, and Sherry has been able to take what Rick built and really expand on it, and I see a terrific future for the program. Sherry has the expertise that comes from running an AHEC in Missouri. She's run clinical sites for medical schools, and I can see us growing this program and developing it and making it into something even greater than it already is. But we're proud of it. We're proud of the entrepreneurial nature of it. We're proud of the way that we've been able to grow it. And I think it's an excellent example of the power of partnerships.
The partnership between the college and the hospital is a natural fit because we're both in service to the community. The relationship is based in both organizations' mission to provide healthcare services to the region. And I brought something to read I think will send a very clear picture of how this relationship works. And the mission of NAPHE is to provide quality, dependable, convenient, and affordable healthcare education services and programs to the healthcare providers, healthcare professionals, and citizens of the North Arkansas region. In that statement, and in similar statements that we have in our mission at the hospital, we are both in service to the citizens of the community. And as we fulfill this mission together, we reach out to the community to provide those individuals who are interested in healthcare education, interested in growing their careers and working in a hospital, and serving those citizens in the community in which they live. NAPHE reaches not only into education, but into services outside the educational realm to community, or the formal educational realm, to community education. And they reach into the schools. They do tobacco education, alcohol education. They reach into the education of teen mothers. There's a number of things that NAPHE does that serves as a great partnership with our hospital. The benefits of receiving well-trained healthcare providers from the hospital perspective allows us to fill those positions of great need in our community so that we are available to provide the services this community needs. Our hospital is about 75 miles from any tertiary care center. We need to provide services in this community. This community needs a hospital. This community needs an emergency room. This community needs some very high-level services to meet the needs of the citizens here. And the college, in partnership with the hospital, in doing these educational services and creating these young folks who are interested in providing that care is invaluable. And it cannot be replaced by any other means.
Hello, my name is Sherry Henricks and I'm the Executive Director for the North Arkansas Partnership for Health Education, what we call NAPHE. And what an exciting partnership it is. About 14 years ago, NAPHE had the opportunity to work with the Arkansas Department of Health to develop the very first ever Hometown Health Coalition in the state. The success of creating a healthy community depended on the commitment of those who live in the community. And that is what the NAPHE partnership is truly all about. Commitment, working together, getting things done for the good of everyone.